So, hello everyone. I have the pleasure and honor of welcoming with me another NEET PG 2023 topper, Dr. Anshul Gupta. He has secured rank of 48 all over India in NEET PG 2023. First of all, congratulations, heartiest congratulations, Anshul, and welcome to DAMS channel. Congratulations, Dr.
Thank you
Anshul.
so much, sir.
So, how are you feeling right now?
Sir, it feels very good and it feels very positive, especially because there is another exam coming in 2 months, and it feels I feel more confident about giving that exam based on this result. So it definitely feels great.
Great. It's good to see the positivity in you that you have already all set for the INI-CET May exam. Tell me about yourself, Anshul. Where are you graduate from?
So I have done my MBBS from AIMS, New Delhi, and I completed my internship in January this year,
Mm-hmm.
and I've come back home after that.
Okay. So when did you actually start preparing for PG entrance?
Sir, like I started studying for PG entrance at the beginning of my internship, but I had started studying in the beginning with a lot of zeal, but then it sort of died down. So I appeared for the November INI CET, and it wasn't that good. I got a rank of 715, and after that I restarted my preparation in January this year when my internship was about to end, and my goal was to complete at least 3 cycles of revision before INI CET. So that is when I started in January this year properly.
But actually you were preparing during MBBS days also for entrance exam?
Yes, sir. Yes, sir. I had joined the foundation course at DAMS and I had started studying from my third year itself. Started making notes for the final year subjects as well. And uh, I had also joined the TND during my internship. So those
So
are
how
the
was
two things
so
that I
you
did.
had a long journey with RAMS from third year to final year to TND. So must be a 3-year course. So in third year when
Yes, sir.
you joined, what all subjects did you attend? I mean third year, final year or first year, second year? Which subject would did you attend at DAMS?
So I remember that the first class I attended was actually a Sumer sir's radiology class, and it was an amazing session. And that was my first class. Sir not only taught radiology in that, but he also gave us the kind of boost that we needed, the motivation that we needed to keep studying for the next 3 years or so. And the next classes I attended were medicine and obs and gynae, and both were amazing. Arvind sir and Dr. Deepthi ma'am. And after that, the COVID pandemic happened and everything closed off, so the sessions converted to online. So after that, I kind of had a huge gap in preparation at that time. So I resumed my preparation again during my internship.
All right. So when you resumed your preparation, your notes were almost kind of ready. Third year
Yes,
and
they were
final.
ready for the final year subjects and for the third prof subjects. But for the first and second year subjects, I made my notes during my internship. Uh, and I tried to revise them as much as I could, but the main revision could happen after completion of internship.
How did you utilize TND?
So the dance T&D sessions are good in the sense that the questions asked are of a slightly higher difficulty level, and therefore they allow us to think in a different and a creative manner, which is very important to attempt the easy questions in the exam, which appear tough. So it's important to have that calm mind, so that practice. And secondly, the discussions are also very wholesome. They cover all the related topics related to that question, which is more important than attempting the question itself. So that is the reason I really like the DAMS TND. Also, I think that it gives you a very concise revision notes for the final leap of your preparation because the main notes are not really revisable at the end. So it's important to have a concise source.
All right. So when you did the TND, did you follow your own schedule or did you follow the TND schedule?
So I followed my own schedule because I've always felt that the TND schedule is made like keeping in mind everybody, and everybody has different requirements, and preparation needs to be tailored according to one's weaknesses and strengths. So I made my own schedule and I tried to stick to it as much as possible. And I think the most important part in any PG preparation is to stick to the schedule. It's it's
Apart
simple.
from TND, any other thing in DAMS that you used?
So I also refer to the DAMS DVT, especially pharmacology, because in pharma it's very hard facts-based subject. So it's important to revise things in a way that you tend to remember, like with pictures or with mnemonics. And I remember attending Thiru sir's DVT. and I think it was really good. It not only covered very high yield and extra edge points from Goodman Gilman, as Sir said in his session, but it also was made in a manner which was very easy to remember with photos and with slides. So I like that.
Hmm. All right. Okay. You have appeared for one INICT in November and you just cleared NEET 2023 March session. Would you like to give an insight about difference in preparation of NEET and INICT if somebody would like to know from you?
Yes, sir. So there is a difference in approach between the two exams, mainly because, first of all, NEET tends to focus more on the clinical subjects, and the tougher questions are usually asked from the clinical subjects. So it's very important to have a strong hold on medicine, on pediatrics, and of course, surgery and obs and gynae, and also on ENT and opthal and ortho, all the third and fourth cross subjects. On the other hand, the INICT exam tends to focus more on the first and second year subjects. So it's important to have a good grasp of those subjects, and the clinical subjects tend to be the clinical questions tend to ultimately refer to the first and second year subjects in case of INICET. So if you have a good hold on first and second year, you can attempt even the clinical questions to a great extent. The second difference is between the time management. So obviously, NEET exam gives you a lot of time. It gives you like 210 minutes for 200 questions. So you get a lot of time to review those answers, and you can put a lot of thought into each question. But in INICET, you have to be smarter. You have to manage your time more efficiently because the exam is giving you only 180 minutes for 200 questions, and the questions are sometimes even more complicated than the NEET questions, having very close options and trying to confuse you with A, B, and C and D. So it's very, I mean, I've given the paper, so I think I know that the paper is framed in a way that it will take time, and you have to be very efficient if you want to complete the paper on time. So those are the two main differences in preparation. Other than that, I think the INICET exam is more PYQ focused than NEET PG. This time also there were a lot of NEET PG PYQ repeats, but then the rank deciding questions tend to be newer and from very new topics. So that's the case. But in INICET, almost all questions are going to be from previous years, and those which are not are anyway the questions which everybody is going to probably leave. So those are the differences, I would say.
Okay. If anybody is starting the preparation right now from third MBBS, what is your advice to the junior who is just starting the preparation from third MBBS?
So I would suggest that you should make your main primary notes at this time as much as possible, especially the clinical subjects, but if possible, also the first and second year if you're able to get time. What's also important is that wherever you feel that you're not able to get the basic concept behind a certain subject or the feel of the subject, it's always advisable to go to a standard textbook and read it at this time because you will not be able to do it later on. And somewhere it does make a difference because it gives you a wholesome view of the subject and what it's trying to convey, and which makes learning facts easier later on. The second thing is that at this time, a student should not focus more on learning things, but rather on making their notes ready to learn later. Because people tend to get very perfectionistic, everything should be remembered at this point, which is not really possible. All you can do is you can give a good effort, good first reading, but the main learning will happen only towards the end because human memory works like that. You have to, plan it like that. So I would suggest that, and yes, and everybody should definitely attend the TNG sessions because they are very important not only to give you a practice of answering questions, but also giving you a good PYQ coverage and giving you concise risk revision notes for the end.
Great. All right. So before we finally conclude this video, any last minute speech from your side? Anything you want to say before we conclude? Any person you would like to thank?
Sir, I would definitely like to thank Dr. Deepti and Dr. Sumer because I remember I attended Sumer sir's class first, like that was my first class in dance. So these two faculty, I think they not only teach, but they also provide a lot of motivational quotes, and some of those stick with you. Like Deepti ma'am once said that you can run out of motivation, but you will always you can always rely on discipline. And I think that is very important because at many times we feel that I don't want to study, but see at that time, you should tell yourself that discipline requires you to study in order to achieve your goals. So I think that is what makes the difference in preparation. Ultimately, because everybody is going to have access to all resources. But what matters is how much effort you're able to put in and how you're able to battle that thought which tells you to not study. So ultimately, the most important thing is to study. That's also.
Thank you so much for your views, Dr. Anshul. We wish you all the best for the upcoming INICET exam. And I hope to interview you once again after the INICET May results. Thank you
Thank you
so
so
much
much.
for being here. Thank you. Bye-bye.
Thank you, sir.